like I said, our members who are in an IE, live in an ALF, or our members who are in the D snip, live at home, are going to need short-term rehab days. Where are we going to send them? We're going to be sending them to the skilled nursing facilities that are partners with us on the ISNP side. So by partnering with Florida Complete Care, you have an opportunity to make money on your custodial residents through a PMPM, also through your short-term rehab as a participating provider for that.
Just quick question, I'm sorry, but
Yes.
the short term that you're referring to are your FCC clients?
FCC, FC2.
Okay.
Yes. So, yes, the members who are enrolled in our Medicare, but are not living in the nursing homes. So they are living in either an ALF.
And they would come in as short term with or without a 3-day stay?
Without a 3-day stay.
Okay.
That's
And
going to be dependent on
reimbursement
medical
for that
necessity.
type of short-term care would be equivalent to?
That would be on a levels contract, so that it's going to be negotiated.
Okay. Having, I'm a little skeptical of the plan, just in general, not specific to this, but this
It's okay. I know that this is a
lot
new
like
age, so we know that this
the
is
HMO concept back in the very beginning.
right.
We're gonna throw services at you, we're gonna keep you healthy, we're gonna keep you out of the hospital, life will be good, and at that point, it was a capitated rate for each and every member that was signed up.
Yeah.
That has since blown apart.
So
And it kind of sounds like we're trying to reinvent that same wheel that blew apart.
So I think that you're right. There are things from that model that didn't work, which is why we're really going towards more incentivized care. So we are really kind of leaning on the things, remember, we know this population, we've been in this industry for a very long time. So we're really kind of going off of that experience of knowing on the things that didn't work with the things that do, and also the direction that CMS is going into. So when we're talking about the capitated rate is really kind of where you would start off as a nursing facility. But the real advantage or the real benefit of where you would want to get to if you do want to partner with any ISNP is you would want to get into some sort of financial risk arrangement. That's really kind of what would make the most sense.
I gotta tell you, if I were an operator, I've been burned already by these risk arrangements.
Yeah.
So if I were an operator, I'd be looking at this with a 10-foot pole. I mean,
There's
you
certainly
would have to do a lot of convincing.
There's certainly a lot of hesitation out there, really from exactly that, from operators, and I do believe that it was from bad experiences in the past. And really, I think it's just about getting with the times, because you guys could be left out of this completely, because we see that members, the Medicare Advantage plans are taking off. We see that what's happening.
But we also already see, at least at some point, Congress was beginning to debate whether or not these types, the Medicare Advantage plans, were truly providing the services that were required of the various constituents. They were getting more and more reports of services not being rendered, not being made available.
Well, we, at least with this administration, we saw that this year, additional dollars were being funneled towards Medicare Advantage plans. So we see that at least for the next upcoming years, Medicare Advantage plans are not going anywhere, and the current administration has shown a preference towards Medicare Advantage plans. So
We're gonna come up losers on this, guys. I hate to be negative on this.
the most important thing is that you guys have the information that you need, and it really just comes down to, do you want to stay in the past or do you want to come into the future? It really is, I mean, I hate to tell it to you guys like that, but it really is up to you, because this is going to take on a life of its own and you don't want to be left behind.
facilities are gonna have to partner with one by 2030 anyways. You guys are aware of that, right? Like, there's no kind of second guessing and second putting this. You kind of have to get involved in some capacity, because like she says, otherwise, it is what it is, it's the future. Kind of have to figure out what your preference is and who's giving you the information and data points for you to be able to continue to deliver the care that you're responsible for delivering, is really what it boils down to, so.
And I really think, listen, and there's a lot of options in terms of, not a lot, but there's a few options in the state of Florida of who you can partner with. I really think it's about finding the partner that you guys feel the most comfortable with. But these kind of arrangements really are inevitable. Okay, so I do want to talk a little bit about some of the enhancements that we are going to be doing specifically at Florida Complete Care. This is going to be very much tailored to our IE population, which is the members who live in the assisted living facilities. So the first thing that we've developed is we have developed this model that we are going to be delivering to every single ALF that partners with us. We are going to be building out a team of doctors that we are going to be bringing to your members. And this is what I call this is our network diagram. And every single one of these tiers that you see up here are the different level of providers that we see that the member needs. So we know that upon day one of a member enrolling, they're going to need certain providers, which is your tier 1, which are the PCPs, the home health, the DME, the pharmacy. The second tier are the specialists. The third tier are the skilled nursing facilities, and that fourth tier is the hospital. So we have gone in and we've developed a network of providers very specific to every single assisted living facility that we work with. We see the needs of that specific population, and we go and we build out providers that work with your facility, that work with your members, and we kind of just are like kind of matchmakers in that. We also make sure that at that tier 3, the skilled nursing facilities that we partner with are going to be skilled nursing facilities that do not take your members to become custodial, right? So we are very, very specific with the SNFs that we go and that we partner with, and we make sure are going to be acting appropriately with the members they get on those short-term days, and also making sure that we have very strong partnerships with the hospitals, and that the hospitals are not going and trying to take the members at that point. So this is something that is being launched now and will be fully launched by September. We are also in the process of developing a hospital diversion program with our clinical staff. This is pretty much a program in which we are going to see a reduction in avoidable ER visits and hospital admissions, which again, from an assisted living facility, this is going to help your residents stay in your beds longer. We are also having some technology enhancements, which is going to allow for real-time eligibility check, instant verification at the point of care. We're going to have a smoother electronic prior authorization process, access to the care plan, being able to view and update it in real time, better direct communication with provider relations and care management, and really having that instant communication with those care managers. So a lot of these things are in the works right now. Starting in August, we aim to launch our hospital diversion program. In September, we're going to be training all of this. By October, we're having it's the CMS annual enrollment period. And by January 1st is our go live where all of this is going to be implemented. So, are there any questions at this point?